Acriflavin glycerin solution contains acriflavin and glycerin as active ingredients. It is used as antiseptic solution. Acriflavin glycerin solution is used for fungal infections, dry or flaky skin, occasional constipation, increased eye pressure, lubricates and moistens skin surfaces and other conditions. Acriflavin in glycerin solution can be applied into the wound as an alternative if proper irrigation is not possible, because it promotes wound drainage and has a hygroscopic action which may reduce local swelling when applied with well-padded bandages. Daily bandage changes are required, usually for the first 5 days. The use of an acriflavin in glycerin compound in the management of contaminated and infected wounds has stood the test of time in general veterinary practices over 5 decades. Acriflavin in glycerin enhances the wound drainage due to its hygroscopic hypertonic action. Acriflavin, like other acridine derivatives, is effective against both gram-positive and gram-negative bacteria. It possesses the advantage of retaining its activity in the presence of body fluids and pus and of being comparatively free from toxic or irritant action. Acriflavin is suitable for the treatment of contaminated or suppurating wounds. Glycerin is used externally for its emollient action. When applied and diluted to mucous membranes or broken skin, glycerin absorbs moisture and enables drugs held in solution to penetrate more readily. It is employed for its hygroscopic action in inflammatory conditions. Side effects of glycerin are flatulence, weakness, dizziness, headache, abdominal cramps, confusion, nausea and vomiting, fall in BP, bloating. Studies in animals have shown risk to fetus, however there are no sufficient studies in humans. This drug may be used in pregnant women if benefit outweighs the risk. Patients should follow the advice of the doctor regarding its use. No studies have been conducted in breastfeeding women, however there is possibility of ill effect to the breastfed infants, or studies conducted in breastfeeding women show minimal non-threatening side effects to the infants. Drugs should be given only if the potential benefit justifies the potential risk to the infant. Patients should follow the advice of the doctor regarding its use.